welcome to Project Recovery, a podcast about addiction. More importantly, it's about recovery, and it's brought to you by our friends at Reprieve Recovery. It's up there in Morgan, all-female facility, 8 to 10 beds, I think it is.
I'm right here. You don't have to shout.
Oh, for more information, I'm excited that you're back.
I'm excited to be back. I have a bone to pick with you, but let's talk about Reprieve.
Go check them out, reprieverc.com, and you'll get all
up in Morgan, where I'm from.
Morgan, yep.
Yeah, you can tell them hi for me.
Morgan's a great town.
Yeah.
And, surprisingly, I remember when Reprieve was putting their facility up there was a lot of pushback.
Well, that's how we roll in Morgan. We don't like anything new. There's still not a stoplight.
Well, but I don't think it's just Morgan. So I just want to put Morgan on blast. I think it's a lot of small towns.
I think that's good, though, because towns don't stay small if they don't control the growth.
Yeah. And so they were like, well, we don't know if we need this. And I wanted to call up Morgan City and go, you know how many people we've had from your small town on our podcast?
Show. Yeah.
So if you're acting like you don't have a drug problem up there.
Oh, they know they do.
What? And everybody knows they do.
Yeah. But I think it's not in my backyard. That's the thing, right? Like we get nervous about those facilities. But what do the stats show about what happens when you have a place like that? Everything improves.
Yeah. Well, and it was George Carlin. He was, a famous comedian, and he started the whole kind of movement called NIMBY. And NIMBY was not in my backyard. And it was started like this, and they were like, hey, you know what? We need more prisons. And everybody would be like, yes, we need more prisons. We're going to put it right here. No, we don't. Everybody wants them, but not in their backyard.
Right.
And so, but that's the thing is.
That's what the West Desert's for.
But that's the thing is. Everything is in everybody's backyard nowadays.
Yeah. Well, the problem's there, so the solution should be there too. And that's why I think I'm proud to have Reprieve there in Morgan.
All right. Well, I'm glad you're back because while you were gone...
You had a great guest, a punk rock guest. I love punk rock.
The perfect guest.
Yeah.
For you.
He played with Dwayne Peters, who's another professional skater. I could have had a lot of fun talking to him, but you went and had him without me.
Like he was talking about... Like he was on the Vans Warped Tour for 10 years.
Wow.
He was left in Hamburg, Germany by his band because he was just
a little out of control. Huh?
Yeah. And now he's doing wonderful things, and it was very cool.
We were talking ahead a little bit before the show about how a lot of these folks come on, and the person sitting in front of us is not the story that they're telling. Like, they're sweethearts, they're doing great things, they're actually improving our communities in ways that nobody really knows unless you talk to them. But they tell these stories about their lives that are just off the hook.
Well, when you think about it, I think that's a big concern for addicts is that we're going to be continually judged for our past discretions. And you know what I mean? And nobody's going to give us a chance again because let's be honest, people have sat down in these chairs and been on these microphones and said horrible things. So much in the fact that we've actually winced, you know what I mean? When they're saying it on the mic going, oh my gosh, is he really saying this?
Yeah.
You know, and you're going, I don't know if we're going to be able to play this because sometimes that's how ugly addiction can get.
Yeah.
But on the flip side of that coin, you then see this gentle giant here with face tattoos talking about loving his daughter and how his life is so wonderful now. And that's the beauty about recovery is that the things you thought you could never get again, you can get again.
It's a 180 in life. People who really live recovery, their lives are so much better and different. And I think that we've even had a few guests comment that they're like, I almost don't relate to that story anymore. I know it was me, but that's so different from the me that I am today, and that's a beautiful thing.
So I get done with my live shot this morning, and I was at Murray High School, and we were doing wrestling.
Are they doing wrestling in the summer at Murray High?
Well, because every once a week on KSL Today, the TV station that I do a morning show for, I'm going out and showcasing Olympic sports you can do right here in the state of Utah.
Okay.
Because the Olympics are in less than 30 days. And so, like, I've done diving, I've done weightlifting, I've done wrestling, I've done equestrian.
Like if you want to do the things the Olympians do.
Yeah. And if you got a young person in your house who maybe has Olympic aspirations, this is a good place to get started.
My high school PE coach was on an Olympic team. You know what for?
What?
Badminton.
I've done badminton. I've done ping pong. And they're all right here in the state of Utah. And these are things you can do. So I'm wrestling this morning, and we were doing Greco and freestyle.
Did you put on the thing?
I didn't put a singlet on.
Oh.
But I did get thrown around.
Yeah.
And so after it's done, we go out into the parking lot. And me and my cameraman are taping a tease for tomorrow. And this truck stops. And he goes, "Are you Casey Scott?"
That's not good.
And I went, "Yeah."
Who's asking?
He goes, "Can I hug you?"
What?
And I go, yeah. And so he gives me a hug and he goes, I just have wanted to tell you what your story means to me and how you're out there living this recovery life. Every time I see it, it gives me hope because I'm celebrating 3 years of sobriety.
Oh, good for him.
That's the beautiful thing about recovery, you know.
Yeah. Well, it's a community, right?
It really is, you know. And so I get little blessings like that throughout the week, or I get messages on Instagram or Facebook saying, "Hey, thank you for sharing your story. I've got this many days of sobriety. Thank you for sharing your story. My son is doing so much better now." I mean, I got this big text last night from this wonderful lady that I've known in the industry for years saying, "Hey, my son wants me to pass along this note to you saying thank you for all that you're doing." And so it's
that's great.
The recovery community here is just so beautiful.
Yeah.
And this gives us an opportunity to stay in touch with it and see what's going on, because really Utah is ahead where most people are behind when it comes to mental health and recovery.
We're not always fashion forward here in Utah.
No.
But we are ahead on the recovery community and all the different recovery centers. People come from all over the country to come here to get sober and to live a life of recovery. And I'm really pleased and proud of that.
Well, I mean, it used to be 20 years ago, everybody would come here. And so much in the fact that I was listening to the news yesterday and Paris Hilton was talking to Congress because she spent some time here as a youth, because a lot of youth facilities were here back in the 80s and 90s.
Right. And many people don't understand the reason for that is legislature. What is legislated in every state determines what you can do based on who can be licensed as a health professional down to what kind of treatment centers you can have, what ages, all that sort of stuff. So Utah's always had a lot of those because it's been legal here and not other places.
To be fair, Paris wasn't saying good things about...
No, she's never been very happy about her experience here.
But I think she's out there talking and she's trying to do good and change it. And I think...
I think she probably was in a facility, or at the time that particular facility was not run well. And I don't think that her experience was unusual, but she has a microphone, she has a voice, and so good for her.
So what I guess I'm saying is that we are lucky to be living in a state that embraces recovery and has many options for you to find your road to recovery.
Yeah, I agree.
So what information do you have for us?
I just brought a quick little bit of info that I thought was interesting. So we have a lot of guests who get into their addiction through maybe what we call a normal way, maybe a surgery, or they've had an injury with chronic pain. Chronic pain and surgeries are two areas where a lot of opiate pain medications in the past and currently are prescribed. And for some people, that's unfortunately what hooks them.
And so you would say it's almost legitimate.
I mean, it's like
I was prescribed.
Right.
I did it. I didn't know I was going to be so inclined to it. And
I have a good friend who was in an ATV accident as a young guy and had many injuries, and that started him down that road. But otherwise, not somebody who would have ever touched heroin.
Yeah.
So I brought this up because I just saw this, a new research study showed we don't really think too much when we think about pain management. Somebody has chronic pain, maybe they have back pain or some injury, and they're just going to maybe have chronic pain for the rest of their lives. And they often are the ones that are prescribed opiate medications, and that's understandable. But we don't usually think about therapy as being kind of a frontline treatment for that.
Now, when you're talking about therapy, are you talking about talking with a therapist, or are we talking about meditation?
Psychotherapy of some sort. So mindfulness, we know that's made a lot of. We have Dr. Garland here at the University of Utah, who is a world famous researcher in this area of using mindfulness and meditation in pain management. And so his research has been groundbreaking. The gold standard therapy, though, has been cognitive behavioral therapy, helping people process how they think and what they do in order to manage their pain. But a new type of therapy, which, spoiler alert, sounds a little bit like CBT, but it's called emotional awareness and expression therapy. Have you heard of that one?
No.
We have a guest that we're going to introduce soon. Jay?
Yeah.
Have you heard of that?
No.
Not heard of it.
Well, listen up.
EAET. And it beat, in this particular study, a study out of UCLA Health. They're no slouches.
So you're telling me words can help me with my pain?
Well, it's a little more than that. That's kind of their point. The CBT is great, and about 17% of the people in this study, which was made up of veterans, almost 200 veterans, about half Caucasian, half African American, and
suffer with
mostly
chronic pain.
men between 60 and 90 years old. They have chronic pain, and they did some therapy with them, and some got into the CBT group, and about 17% of those had a significant reduction in pain, which is great. That's a lot of people.
Sure.
But this EAET, emotional awareness and expression therapy, 30% reduction.
Double.
And over time, we still had 40% at 6 months. 40% of the people that got the benefit still felt the benefit. So that's an outcome study. So let me tell you what it does really quickly.
Okay.
They would come up to a patient, if you were a patient, and they would ask you to recall a difficult or traumatic memory, engage in experiencing how the related emotions feel in the body. So you would tell me, I'm going to think about this previous traumatic experience that I had.
I jumped off a deck trying to land on a skateboard and broke my ankle.
There you go.
True story.
I'm sure it is. You've got a lot of those.
Yeah.
Yeah, skiing.
Uh-huh.
Sure. So you would recall that. You would talk about it. Then you would talk about where in your body you're feeling that pain or stress or just tension that's coming from telling the story. And they would have you express that in words. You would use real words instead of just saying that sucked. You would use these are the emotions that I'm having. So emotional vocabulary training is probably part of this. And then they don't really, I need to get into this to understand, they release or let it go. So that is both a cognitive and a verbal thing of letting those emotions leave your body. So that sounds a little hokey on the surface, but if you think about what's happening, we've talked about thoughts, feelings, behaviors a lot on this show. How we think about things directly impacts how we feel and what we do, but those feelings are also physical. And so if you are holding in emotional or psychological stress and feeling physical pain at the same time, by understanding that stress, identifying it, and then letting it go, you're also sending signals, most likely, from your brain to that part of your body that release the pain as well.
Wow.
Yeah, cool, huh?
Nerdy, but cool.
Super cool, super nerdy. That's why I love it. But the truth is, I always love coming up with things that show how therapies of various kinds are just as powerful and then sometimes more powerful than the drugs and medications we take, and they're more sustainable. So I thought that was cool.
No, I love it.
Anybody who's dealing with chronic pain out there who might be worried about the amount of medications they're taking, this is a new therapy, emotional awareness and expression therapy they could look into, but they could also look into mindfulness training and meditation and cognitive behavioral therapy.
Let me ask you, and maybe you don't know the answer, maybe Jay does. When I hear the term chronic pain,
Yeah.
I really can't fathom what that is, because none of the pain I've ever had has been chronic.
Right.
I mean, it's always been, incidental. You know what I mean? It's like my ankle hurt for a week. My hip hurt. I've never been in pain over a long period of time. And so I don't even know what that would do to the psyche, to the body, to the mental, to what it all does. But there's a lot of people out there who suffer from chronic pain.
Yeah. Do you want to take a crack at that, Jay?
Yeah, so I think probably one of the common things I see in a lot of my clients are chronic pains and migraines. Mm-hmm. They're apparently to the point where they can't really function. So clients late for days, right? And they don't understand why either. Sometimes they say it's genetics. My grandma used to have it, or mom used to have it, right? It could be that. Or sometimes it's also because of trauma. I don't know if it's statistical or not, but some of my clients who had a lot of trauma in their life, a lot of trauma incidents in their life, their pains doubled and actually got worse throughout the years.
Oh.
So maybe there's some connections between the incident, right, the situation, trauma, and the chronic pain.
Because I have a sister-in-law who suffers from migraines.
Yeah.
And my brother would be like, well, she's got a migraine. And I go, well, just tell her to get some aspirin and let's go. And he's like, no, you don't understand. I mean, she gets them so bad that she has to go into a dark room, blacken the windows, turn out the lights, and just try to let it pass.
Yeah, no, I used to get migraines. It was about 6 years ago. This isn't a joke. It was when I was getting divorced.
Oh, really?
I got migraines. Sometimes I couldn't work.
Because that was going to be my joke.
I'm getting married next month. I feel a lot better. I haven't had a migraine
My
in a long
ex-wife
time.
used to have migraines all the time, and then she
How's she
divorced
feeling
me.
now?
Yeah, she's probably pretty good.
We should check in with her.
Yeah.
Well, chronic pain is hard because it's usually nerve related. Mm-hmm. So there are migraines that are chronic pain, and then there's injury chronic pain. So maybe a lot of these PTSD, these folks in the VA might have had some, physical injuries. I had a young person who's only about 30 in my office this week who has a slipped disc. And it's not really from an injury, it's just sort of degenerative disc stuff. And so he'll sometimes have it to where he has pain just radiating down one of his arms, and he's a computer tech person and he can't work because his fingers will be numb.
I know, and I don't know if I'm using this word right, but psychosomatic, where their brains can make their body feel like they're in pain. We've had people on this show who've been addicted to drugs who have said that their brain has tricked their body into being in pain to justify why they're doing drugs.
Well, actually, there's neuro research that proves that that's true, that opiates create more opiate receptors, and therefore your pain increases when you're not filling up those opiate receptors. Psychosomatic used to be used back in the day sort of as a put down, saying like, oh, it's all in your head. It's, if you just think harder, be tougher, you'll be okay.
Rub some dirt on it, walk it off.
What we found is that actually the link is almost irrelevant to talk about. Your mind and your body are intimately connected. And so what we usually see happen is, like Jay was bringing up, if a person has a traumatic experience, so maybe that's their psychological perception and emotional experience with maybe a near-death experience or some other tragedy, that is emotional pain, psychological pain, but it also affects their body. So that's one and the same. And when a person maybe has an injury and psychological distress, then that injury pain usually is increased. And so I think that's what this emotional awareness and expression therapy is about, is trying to get us to express and detach from the psychological emotional part so that our physical pain can decrease. Well, so it's actually an exciting area of medicine, psychology, and science, where we now have the ability to measure a lot of these things on a much more acute, scale, and we can understand how the mind and body works together. It's pretty fascinating.
Well, I'll let you introduce our guest, and then we'll take a break and we'll get back with more.
Well, I'm excited because he's a friend of mine. He works with me at the University of Utah. His name's Jay Cho. Jay, we're going to have you come back on after this break, but he's a social worker extraordinaire. He has many expertise, and I get to be in a meeting with him every week and hear about what he's up to, and so I'm excited to have you on the show today, Jay.
Stick around. More with Jay coming back. Hey, welcome back to Project Recovery. I'm Casey Scott. That's Dr. Matt Woolley. He's a clinical psychologist, and he's brought along his friend today, Jay Chow, who's you said... Cho.
Yeah, like a Toto train. Cho.
I like it.
You use that a lot, don't you?
I do.
To break the ice, huh?
Yeah.
So let's talk about it. Matt said you're a social worker extraordinaire. How does one choose the work of social?
That's a good question.
And weirdly put, but go ahead.
It explains me perfectly.
I think a social worker. I think social means connected. I think as a humans, we all have that desire to connect it, right? And I think workers means then persons that helps them connecting, whether that's connecting with other people or to connect it with themselves. Right? I think that's where social worker comes in. That's my opinion of it.
Let's put it this way. You're in an elevator, you're talking to me, and I go, what do you do for a living? And you say social worker, and I go, what does a social worker do?
I think we wear many hats because I would probably tell us later, but the reason I chose social work is because there are a lot of things that social workers can do. You can be working in hospital, helping clients with their crisis or discharge summary, or you can also work at hospice, talking to families of loved ones, or you can work at a school, right? Talking to kids and making sure that they learn coping skills, or you can be a therapist. So there are a lot of different hats. The social
amazing.
Workers do.
Yes, social workers have a lot of different areas they can specialize in. For example, my brother and sister-in-law, during the adoptions that they've had of their children, have worked with a social worker who specializes in adoption. And in a situation like that, you can see how important it is. Like, you and I, if we wanted to adopt someone, we wouldn't know how to do that or what the process is. So they specialize in, I think, helping other human beings in a variety of different ways at schools, like hospice when somebody's, leaving this life, in the hospital. And a lot of the therapists that have helped people in recovery are social workers.
Well, so much in fact that a lot of people who graduate into the world of recovery often go back and get their LCSW license.
That's right. They become social workers themselves.
And because they knew what it meant, and having somebody there for them was amazing. So if they can be that for somebody else, that's all part of recovery, is giving back.
Now, to be, you can get an undergraduate degree in social work, right, Jay?
Yeah, you can get the Bachelor of Social Work.
Bachelor's, but you also have what?
A Master of Social Work as well.
Yeah, where'd you do your master's?
Oh, Michigan State University, actually.
All right, so that's a big school, just so you know. Academically, that's a pretty impressive place to go to school. How'd you get to be in Utah?
Yeah, so my wife's parents, I think, moved out here in around 2017. And during COVID, when everything shut down, we wanted to move to Utah to be close with her family. So we moved out here in, I think, June and July of 2020.
So what do you say you specialize in? He says that you're an expertise in a lot of fields. So where do you feel like you excel the most?
Yeah, probably as of now, probably 3 areas. DBT, Dialectical Behavior Therapy, ADHD, and probably trauma.
So let's start with ADHD, because we seem to get a lot of people in here on this podcast who were growing up and suffering from ADHD and trying to find that missing piece. And a lot of times that missing piece was drugs and alcohol that made them feel kind of whole. So what are we seeing about ADHD?
What are we seeing about it?
I mean, how do we diagnose it? What is it? For those who don't know.
Let's ask the expert.
Yeah, so usually what we know is back in, before 2013, there was two types of ADHD, right? There were ADD, attention deficit disorder. We used to call it the quiet side of ADD. It's where it's all in your basically head, right? Where you get distracted a lot, or you're daydreaming, you're losing things a lot.
He said, "I feel seen."
Right? That's a quiet side, and then there is another one, which is ADHD, Autism Deficit Hyperactivity Disorder, and that's where I see more louder ADHD. This is where often people would jump out of chairs, impulsive, like screaming, blurting things out, can't wait in turns. That got all changed, I think, after 2013, and now we have 3 kinds. ADHD inattentive, which is basically ADD. And then there's ADHD hyperactivity, which is ADHD. And then there's ADHD combined.
So that's both of them?
Yes, you have both of them. Yep.
So what we know about ADHD or ADD, is it genetics? Is that how does that come into our body?
That's a good question. I think it's genetics usually.
So they consider it a neurodevelopmental disorder, and so it definitely runs in families, but it doesn't have to. People who don't, relate to that themselves as parents or with their siblings might have a child who has that, because the executive function system, the last part of your brain, your frontal lobes, that's where a lot of our attention, focus, concentration happens. And then there are other areas of the brain involved, especially like Jay was saying with the combined type. So it typically runs in families, though you usually can see it as sort of a family thing.
Back when we were kids, the remedy was Ritalin. I know my brother got put on it, and
in the 80s, that started to be kind of this new medication, methylphenidate that you could, the brand name Ritalin, you could dose a kid in the morning and the afternoon. And it was pretty unsophisticated at the time and somewhat helpful to certain people. I think mostly to people that felt like they had the hyperactive component.
Is the way we treat it now, is it still with medicine, or is it through other ways?
Well, there's a lot of other ways, and Jay does a lot of treatment. What are some of the effective things you like to do with treatment in ADHD?
Yeah, so I tend to both. So usually with executive dysfunctioning, or especially with adults, I tend to go into CBT, actually, cognitive behavior therapy, to especially help them with organizing thoughts, or to help them with time management. Even myself, sometimes I'm late to things a lot. We often late to and also sometimes we lose things a lot. So I help them teach skills that way. And also, I think people with ADHD tend to struggle a lot with emotion regulation, right? And impulses and urges. And I tend to teach cognitive behavior therapy and dialectical behavior therapy to help them in that way too.
So let's dive into a couple of those therapies now and do that. So CBT, cognitive behavioral therapy, and that is what?
It's basically a therapy that says that there are three links between thoughts, behaviors, and feelings, and they're all connected to each other. And basically, let's say that this is a true story. I was late. Like, let's say that I got here late. So that's the situation, right? And the thought could be like, oh man, I'm late, like I'll be in trouble. And if I think that way, I'm gonna have some kind of feelings, right? Maybe I'm feeling anxious. Oh man, Matt's gonna yell at me. He never will, just let you know, but maybe he will, right? And because I'm thinking that way, my behavior could change, right? My behavior could be like, oh, maybe if I just run out of here and say, oh, I'm sick or something, then I can avoid it, right? So all these are connected, thoughts, feelings, and behaviors. And usually, often, what I deal with it can usually make the situation worse. So CBT aims to change that.
And so give me same example, how you could react different to change it.
Yeah, so let's say the situation is the same. Like I was here late, right? A couple minutes late. Instead of thinking, oh, maybe I noticed the thinking, oh man, Matt's going to yell at me. Alternative to that, more realistic side of it, I'm like, no, he's my coworker. Like, he has to see me every week. I don't think he will. Right? Right. And because I'm understanding of that, because I'm thinking, oh, maybe he will, maybe he won't. But realistically, he won't. Because of that, my feelings of anxiety could maybe change to tolerating, maybe change to more calm. And because I'm more calm, instead of running away here, right, and going back to my home, I'm staying here and I'm in the radio right now, right? I'm in the podcast right now.
I love it.
Yeah. Yeah, that's a great example of how to reframe your thoughts, how to think differently. So, that's one of the things that cognitive behavioral therapists like myself and Jay do is we help people identify, like, what's a thought that's sort of leading to a heavy or difficult behavior? And could I challenge that thought for a more accurate way to think? Like, Jay and I, we were in a meeting every week, so it makes sense. He's like, oh, it's kind of unlikely Matt's going to yell at me for being late. Plus, Matt's not really a yeller. So, that makes him feel more calm, and then we're sitting here having a nice time.
But I got to think that CBT is a learned behavior in the sense that, because his first response was his initial response.
Yeah, it was kind of an anxious response,
Yeah,
right?
you know what I mean?
And a lot of people naturally are anxious or naturally inattentive, right?
So that means taking a step back, thinking about it, repurposing it, and refocusing your energy and thinking, okay, because I think we are very reactionary by nature.
Most people are, yeah, and especially a lot of people who find themselves in recovery tell their life story, and we realize they have two major things. If it's not like a surgery or something, remember we get people that talk about being super anxious when they're young, or really inattentive and ADHD, and so both anxiety and ADHD are pretty uncomfortable feelings to deal with every day, and so those sorts of things lead to wanting to feel better. And when you're young, especially if you're impulsive with ADHD, then you're going to try something like, oh, maybe I'll have a drink, or maybe I'll try this pill, or maybe I'll smoke weed. And eventually they find things that work in the short run, but have disastrous consequences in the long term.
So DBT is what?
DBT is called Dialectical Behavior Therapy. It was created back in 1970s and 80s by a psychologist named Marsha Linehan. I think she actually admitted recently that she herself had this personality disorder called borderline personality disorder. And at that time, when she was young, there wasn't any treatment for it besides medications, and the term didn't exist at the time. And she was thinking to herself, man, this is really bad. I'm really struggling. But once she recovered, when she started feeling better, she wanted to create treatment for people like her. That's where the DBT comes from. But now it's being used everywhere.
So we talked about the other one. So what is DBT? I mean, how does that differ?
So Jay, give some examples, because you work a lot with DBT, and it is born out of cognitive behavioral therapy. So it's a type of thinking and talking therapy. Well, what's a dialectical? Like, what is that word? Because that's a weird word.
Yeah, most people ask me, what does that mean? Dialectical basically means two opposite truths can be true at the same time. Basically, acceptance and change. Those two words seem very out of ordinary. Like, those two can be true at the same time. But in DBT, two opposite truths can come together at the same time. And because it comes together at the same time, it creates a whole new truth.
So is there an example?
Yeah, so if you think about it, so are you guys a fan of Detroit Lions by any chance?
Lions?
Uh-huh.
I love Lions.
We did really amazing last year, but we weren't so good a couple years ago. So when you think about Lions, I'm assuming in the locker room, they're always thinking to themselves, we're going to win this game, we're going to win this game. So they're actually trying their best to win the game, right?
Yeah.
And as, I'm so sorry, Lions fans, but as history shows, sometimes that doesn't result in results, right? So they need to try better. They need to do better, right? Learn better. And if you think about it, those two, it's kind of opposite. They're trying their best, and at the same time, they also need to learn new skills so they can be better at the game. Those two opposite truths can be true.
I like that.
Yeah.
So that's the dialectical part. What's the behavior?
Behavior part is what you do, right? So a lot of clients I see with DBT seems to struggle with a lot of behaviors. So behaviors could be impulses like yelling and screaming. It could be throwing things. I've seen a lot of self-harming behaviors like cutting, things like that. So how to deal with that behavior, how to replace the behavior.
And be kind of aware of those dialectics, right?
Yes.
So what are their competing thoughts and feelings or thoughts and needs? And so by helping the patient or the client learn what those are, then they do exercises. It's actually quite involved. So how often during the week would, let's say, somebody who's using DBT to help them in their recovery, like a typical DBT full program, that's pretty involved, right? What do you do?
Yeah, I would say usually 6 months, maybe 12
About
months.
6 months.
And that usually includes once a week individual therapy and also includes once a week group therapy. So group therapy is more about helping them learn skills. And the individual therapy is basically help you apply the skill in your life.
And then a lot of journaling, right? A lot
Yes.
of daily exercises.
Daily exercise, especially with feelings on what they're struggling with. It could be anxiety, it could be shame, or it could be guilt. And what you do with these feelings to cope with it, that is maladaptive. So it could be, I drink, or it could be, I self-harm.
Yeah.
So basically and they journal it and then learn skills so that they learn to replace it with something else.
You know, you brought up the term journaling, and that is something that we did in my recovery with the 45 days that were there. We started every morning with intentions. We ended with gratitude. But in between there was a lot of journaling. And at first I was like, man, this seems like sucky. You
It's
know
a
what I mean?
pain, right?
Yeah, you know, but once you go back and you look at them and you can write down your feelings and your thoughts in the moment, you can start to get an outline of triggers. You can get an outline of things that bring you uneasiness. You can get an outline of things that worked well. And so the power of journaling is wonderful.
It's super powerful. I will say that I even have a hard time asking my clients to do it because I hate it so bad. But the truth is, it's super powerful, and you're essentially creating an analysis of yourself. And so, as Jay was saying, like, let's say a person is struggling with anger management, or let's say they're struggling with self-harming or drinking, for example, and they're journaling every day those dichotomous thoughts and feelings that they have when they're about to self-harm or when they're about to drink or after they've drank. You know, what are they, and then bringing that back to group and bringing that back to therapy. And now you have this roadmap of your thoughts, feelings, and behaviors, and how to have two things like, well, you know, a good person, you know, doesn't drink and I drank, so I'm a bad person. That might be something that they journal, and then they bring that back in and discuss how, you know, you can be a good person who also drinks, and you can be a good person who needs some help. You know, and now we bring those things together in a therapeutic way where a person can change their whole attitude, because most of us grow up without realizing it with a lot of black and white, all or nothing thinking. And that's one of the big things I think that we've seen here on the show is people like with your personality, Casey, you're all in on whatever you're doing. I don't know if people have picked this up about you yet,
Yeah.
but Casey's all in on everything.
I just bought $1,000 worth of fireworks.
Yes, I was gonna say, you know, Matt would have been like, $50, that's a lot of fireworks. But Casey's all in with
If we're gonna light up the sky,
$1,000.
we're gonna light up the sky.
Yeah,
You know what I
exactly.
mean?
But see, you can see how that personality can be prone to all or nothing thinking in a negative way, not just a fun, positive way.
So what are you seeing out there in the world when it comes to recovery and addiction? Do you work much with that?
Yeah, so I'm actually shadowing the host was the guest was with Bryce actually because I'm helping
Bryce
them.
Herrera was on our show.
Love Bryce.
Yep.
Yeah, I'm actually shadowing him and his team because I'm actually creating, or the U is creating a mental health IOP program. Mm-hmm. So I'm actually shadowing them and recovery girl. And I see DBT and recovery thinking can really go hand to hand, especially teaching them with skills, right? So I usually think that the reason people recover too is the urgent impulses, right? And the trigger situation. And with DBT, I think I can help them replace it.
Yeah. And, one of the biggest things we talk, that term white knuckling it for somebody in recovery.
Yeah.
They're just grit and strength every day trying to. That's exhausting, and it usually is not a long-term outcome that's good. We might call it a dry drunk.
Yeah.
We don't say that word anymore, but
No.
I still like it.
I do too.
Yeah, but anyway, dry drunk or somebody who's angry, they're not happy in their recovery, and they start thinking, well, this recovery isn't worth it. I was much happier when I was drinking, right? And DBT and cognitive behavioral therapy and other therapies can help people who are in that situation change how they're thinking. Remember, thoughts, feelings, behaviors. Mm-hmm. If you can change how you're thinking, if you can learn that two seemingly opposite thoughts can actually coexist and I can deal with that and change my behavior because of it, all of a sudden you're not having to white knuckle it all the time and you're living a life that is better and more than you thought it could be because you've changed how you think about your experience and the experience of your life.
I mean, and I think that's so important. And you talk about the dry drunk and the people that are white knuckling it, and they might not go, I was happier drunk, but I wasn't as mad, or I wasn't.
Well, it seemed better in some ways. They start to romanticize it, right? Because they're like, well, at least on Friday nights I was happy for
and I'm not,
for a
not
minute.
as much pain. You know what I mean? Now I'm just miserable and sober.
Yeah. So tell us about the intensive outpatient program that they're developing up at the U, because I know they're doing it. I'm not involved in it. What's that going to look like? If Bryce is in charge, then we know that it has a lot to do with substance recovery, right?
Yeah, I think it's separate. Where recovery is all for recovery, with the mental health is general. So it could be like anxiety, depression, and PTSD, or different things. So basically, what it stands to help with those who feel like once a week therapy is not enough, meaning they need more support than once a week. So we supply them with this IOP is group therapy 4 times a week.
And so you don't have to be suffering from an addiction to be in this IOP.
No. With mental health IOP, no.
But we do have the Recovery Works program.
Yes.
And that is a similar type of program if you do have that. But tell me, I will say that I do sometimes have patients who say, I wish I could go to therapy more often, but maybe it's an insurance issue or, Matt's schedule's full. What about for you? Do you ever have people that are like, I think I'll benefit from going to an intensive program for a little while?
Yeah, I think it's clients like that, especially if I feel like they just got out of inpatient, or if I feel like clients just went to a significant trauma event. So it could be like divorce, or it could be someone just died. And I feel like, oh man, one psychedelic is not enough. I need to see a lot more, and you probably need a lot more stabilizing. Then I think I suggest therapy.
Which this is interesting because this is the first time I've ever thought about this, is that, an IOP just for mental health, not for substance abuse by any means. Sometimes they go hand in hand, but for somebody who's just needing some help, you know what I mean? And having a little bit more than you're right, once a week with a therapist.
Yeah, and I think like Jay brought up, we go through traumatic events in life or difficult times. If you don't like there's big T and little t in trauma, and actually they've shown that a lot of little traumatic events can add up to be more devastating than one big traumatic event. We used to only think of post-traumatic stress disorder as being something when your life and limb were at risk. Maybe you were in the military and in war, you're in a terrible car accident, and you have PTSD, and certainly that can be the case. But a lot of people of all socioeconomic statuses have periods of time where they might go through several smaller traumas. And we know that the people who come and share their stories with us here, I mean, that's all their stories are. When you're running and gunning, as they say, and living a life of addiction, you have a lot of traumas that stack up. I mean, little traumas, like how about getting fired from a high-paying network job, Casey? Does that?
Well, I was thinking about it. I did have a therapist when I got divorced.
Yeah.
It was beer, and it sucked. It did not, you know what I mean?
Yeah.
It did not end well for me.
Yeah.
But I was going through severe trauma during that time from the divorce, losing jobs, half the stuff in my house leaving, missing my kids 50% of the time. Those were all traumatic experiences for me that really took a toll on my body and mind.
And fed into more drinking, right?
Yeah.
Absolutely.
Well, I'm not kidding, but
And more isolative
alcohol was
behavior.
my therapist. I mean, that's where I ran
Dr.
to
Beer?
every time.
Dr. Bud Light.
Yep. And it just didn't end well.
No, and so I mean that's what people like Jay and Katie, who was on the show, and Bryce, what they're going to be doing is helping people develop this or they're developing a program to help people who can maybe head that off before it becomes too difficult. And then you have people in charge there that might know, hey, maybe we need to get you over to Recovery Works instead of the IOP. Like, so it's nice to have that in-house crossover at Huntsman Mental Health Institute, where we have professionals like Jay that can help with all those things.
Well, Jay, I think you're fascinating. I think you're wonderful. What advice would you give somebody out there who is seeking help?
One advice is sometimes I feel like when clients are really struggling, they feel like they're at the tunnel, right? And they can't really see the light at the end of the tunnel, so they feel like they're stuck. I would call it like a roller coaster, meaning it's down, right? But if you just keep fighting it, seek the help, medications or therapy, sometimes both, right? And you just keep moving forward, eventually you will see the light at the end of the tunnel. And then usually I think, yes, you're struggling right now. But if you think about a couple of years from now, if you look back on it, maybe you'll laugh about it, right? Mm-hmm. So that's what I usually advise the clients.
Have you seen my mugshot? We laugh about it all the time.
Yeah, it's a good one. It's what do you look, Nick?
Nick Nolte's son.
Yeah, you look like Nick Nolte's son. Yeah, that's a good one.
Well, thank you, Jay, for stopping by and sharing your wisdom and your stories. You're an amazing individual, and thank you for all the good that you're doing out in the community. And Dr. Matt, thank you for hooking us up with him. And we love it when we get some big brains in here and sharing their wisdom.
Well, somebody asked me the other day, because I've been coming up this fall 21 years at the University of Utah.
Wow, congratulations.
I don't know. It's a long time. I'm an old guy. But they asked me, and that's how come you've stayed at the university so long? Why do you like to work there? Because a lot of people who work, psychologists will then go into private practice, maybe make a little more money, have their own schedules a little bit more, that kind of thing. And the reason that I've stayed at the university is because I get to be around a lot of other professional people that are bright, energetic. It feeds my knowledge of being a better psychologist. I get to do teaching, and I get to be, in meetings and work directly. Jay and I have offices on the same hallway, and I get to be able to talk with them and hear what they're doing. And it inspires me, I think, to be a better professional person. I don't want to get old and weird sitting in a private office by myself all the time. That could get
high
ugly.
tide raises all ships.
Exactly. So the University of Utah is a great resource. We have highlighted a lot of other wonderful resources on this show, but HMHI is doing big things, and people like Jay are helping it happen.
Hey, so Jay, thank you very much, my friend.
Thank you for having me.
And thank you for stopping by and listening to another episode of Project Recovery. And in case you forgot, Project Recovery is what?
It's a KSL podcast.
Like a cho-cho train?
Like a cho-cho train.
Nice.